Thanks for joining us today. Good morning. Since we have more people than usual today presenting, I'm going to keep my comments really short. We passed an important milestone in Snohomish County this week. 500,000 vaccines have been administered, and I believe that translates to about 30% of our residents over the age of 16 fully vaccinated. So congratulations to the team. A lot more to do, but that's a great milestone. So we really know that getting every resident vaccinated is one sure way to end the pandemic. We aren't there yet, but we're getting closer every day. We just have to keep at it. If you're over 16, please sign up for a vaccine and help us end this worst public health crisis we've had in over 100 years. So we'll find out this week whether we'll be rolling back to phase 2. Our case rates and hospitalizations have been going in the wrong direction, so stay tuned there. So everybody knows at this stage what we need to do: get vaccinated, wear masks, don't have indoor gatherings if you aren't vaccinated, and stay disciplined on physical distancing. Even if we do roll back phase, we're going to continue to get vaccines into arms just as quickly as possible. Our capacity, as you know, is significant, and we're going to continue to keep pushing as hard as we can. So if you don't like wearing masks, and if you don't like seeing businesses restricted, if you don't like being able to go into a restaurant with your friends, get vaccinated. That's really how we end this. So with that, I'm handed over to Dr. Spitters of the Snohomish Health District.
Thank you, Executive Summers, and good morning, everyone. With your permission, I'm going to share the screen here. That should be popping up. That shows we've got a slide here to just show the number of cases that we've got. But I forgot one comment before we get rolling on COVID, just to divert your attention back. The final 2021 to 2023 state budget adopted on Sunday by the state legislature makes significant and historic investments in the state government's public health system that also supports local health jurisdiction. So the Health District would like to thank our legislature for that. By securing ongoing and dedicated funding for foundational public health services, the Health District will finally have a predictable funding source that we need, allowing us to meet the growing demands we face today for not only things like COVID, but all the other public health challenges that currently are sitting on the side, but awaiting our attention as we move forward with planning and preparing for whatever the future may hold. So back to COVID, I'd like to share first this slide that shows you each bar is a week across time. This is a familiar shape with the previous waves 1, 2, and 3, and then now we're in the 4th wave. And you'll see a little downtick, which might be good news. You know, in the last couple of weeks, we've had about 1,800 cases in the last 2 weeks, with maybe a decline in the most recent week ending April 24. However, we had a problem with our fax machine that many of our case reports come in on, and we had a system shut down and the memory was lost. And so we had to reach out to all the healthcare providers and such and ask them to resend all those, everything that arrived since last Wednesday. So we might have an adjustment in that number upwards as the week progresses. And so that's a provisional number. But if we look at these numbers translated into rates, as Executive Summers mentioned, things continue to go in the wrong direction, up. For the 2 weeks ending April 24th, we're now up to 223 cases per 100,000. So that takes us up into, that's one of the 2 criteria for falling back into phase 2. The other is to look at the 3-week or the 1 week hospitalization rate. And this is based on the state's counting of every COVID case that gets newly hospitalized during the preceding week. Now, for the week ending April 24, that was up to 5.3. It's gone up a little bit since that, so we'll have to see where that lands. But those are all north of the threshold of 5 hospitalizations per 100,000 per week. So that clicks both of the parameters the state uses to monitor the return to recovery, making it likely that we would be asked to move back to phase 2 by the state next week. Moving on to vaccines, as Executive Summers mentioned, in the past week, we eclipsed our 500,000th vaccine dose administered in Snohomish County, and our dashboard shows us now at nearly 540,000 Snohomish County residents having received, or 540,000 doses administered to Snohomish County residents through April 24th. This includes about 330,000 who have gotten their first dose and 220,000 approximately who have completed vaccination. These vaccines have been administered by all providers in Snohomish County, including private healthcare system clinics, the federal retail pharmacy program, and all mass vaccination sites and activities coordinated through the Snohomish County Vaccine Task Force. The task force brings together public health, emergency management, law enforcement, fire and emergency medical services, human services, transit, public works, tribal governments, and other partners within Snohomish County. Our vaccines supply allocation has been pretty stable. It looks like before the federal retail pharmacy allocation that we've got 45,000 doses coming in this week, roughly equal split between first and second doses. That's last week, our total allocation before the federal retail pharmacy allocation was 55,000. So still pretty strong with about 20 to 25,000 first doses. Based on our current projections, anticipating that we'll have a minimum of 15,000 first doses weekly. The upper end of that range would be 35,000, and mostly we're seeing about 25,000 per week. So when you roll that out, how long would it take to reach saturation or 90% coverage of all adults in Snohomish County? Probably sometime in mid-August or so. Could be a little bit faster if the supply is quicker. Could be as much as a month or so shorter, or a month or so longer to roughly complete the vaccine rollout in adults. So kind of a range of maybe July to September, October, with the midpoint somewhere in August. So that's where things sit with the vaccination effort. But this is still several months off. The current wave that I showed you earlier is ongoing now. And while current vaccination efforts clearly have contributed to stemming that and the coverage in the older adult population to reducing the hospitalizations and deaths associated with it, you can see that we're still triggering the state's metrics for concern and wanting to kind of slow society down so that we don't get out of control again. So with several months of this ahead and not being out of the woods yet, it's time for all of us to step up our efforts. That means continuing to wear a mask when outside the home and when around people you don't live with, wherever you are. Taking it outside for small gatherings and avoiding large gatherings, especially indoor ones. Keeping indoor spaces well ventilated, keeping your hands washed, sanitizing frequently, and getting vaccinated as soon as possible once eligible. As Executive Summers mentioned, our pathway out of this, these serial waves and the impacts on our society is for everyone to get vaccinated. So to share more about that and about the Snohomish County Vaccine Task Force's efforts, I'll turn it over to the county's Director of Emergency Management, Jason Biermann. Jason.
Thanks, Dr. Spitters. Good morning, everyone. So going to keep going with the theme, which is getting vaccinated. So I appreciate the comments from Executive Summers and Dr. Spitters. We've been hearing a lot about vaccine hesitancy around the country. Certainly also in some parts of our state, there seems to be waning interest. And so as the Vaccine Task Force, we want to continue providing vaccinations via many different avenues. our mass vaccination sites, mobile clinics, and in-home vaccinations, which I know we're going to hear more from Shawneri. Community-based clinics in partnership with lots of service organizations and other organizations that represent marginalized communities, and essentially doing everything we can to bring vaccines closer to folks. While we're hearing about the waning interest, all the indicators in Snohomish County are that the majority of our residents do want to get vaccinated. As Dr. Spitters mentioned, we've got about 1 in 3 of our residents over 16 now who are fully vaccinated. So we have a ways to go, but we want to make sure we're doing our part to make sure that access is there for everyone. So a couple of things I want to provide in terms of update with our mass vaccination sites. So first, beginning yesterday, we're now releasing appointments 1 week at a time. Historically, we've been releasing appointments usually only a day or 2 in advance. There were lots of reasons for that, mostly around our planning and making sure that we had vaccine available, making sure that we were tailoring the availability to the tiers that existed, making sure that we were prioritizing those. That takes a lot of effort behind the scenes. But we know that for our residents, getting a vaccination takes planning. For some folks, it means you have to take off work, get childcare, carpool, or get transportation. So we feel like releasing the signups a week in advance will give you more time, our residents more time to do that planning. We're going to continue to post reminders so folks know that these appointments are available throughout the week, but we want to make them available early on so that residents can make plans and get the resources they need to go out and get vaccinated. Secondly, we're going to offer more what we call second dose catch-up clinics. We've offered these in the past and they've been very well received. These are clinics that we host at our mass vaccination sites, and these are appointments specifically for folks who are otherwise having a hard time getting their second dose. Sometimes that's because they may have moved. It may be that they got a first dose somewhere where the provider is not able to provide a second dose. Our goal now is to do at least one of these second dose catch-up clinics every week. You can register for these through the website or by calling the COVID call center at 425-339-5278. We'll share these clinics via the web and through social media. If you got your first dose at one of our mass vac sites, know that these second dose clinics are not going to replace the notification you'll get to make your own second dose appointment. We're adding these so that folks who are having a hard time getting their second dose can get it. If you received your first dose at one of our mass vac sites, you should still sign up through the email that we send you as a reminder to make your second dose appointment. The last update, we're also going to start with evening clinics. We've expanded weekend availability. The Ashway Park and Ride site is operating on Saturdays and Sundays. We seem to be getting a lot of folks going through on those days. At Ashway, we'll also have appointments available until 7 p.m. So we're hoping that will help folks who may be getting off of work, help us get a better idea of how much interest there is in later hours for our other vaccine sites. And bottom line, we know that not everyone can make it during sort of regular work hours. So we wanted to expand availability again, so folks have more access. Just final reminders, all of our appointments, all of our mass vac sites continue to be by appointment only. We have a lot of appointments available for the coming week. So I just want to reiterate what both Executive Summers and Dr. Spitters have said. Please make an appointment. We can't encourage you enough that now is the time to get vaccinated. We know folks waited very patiently till more appointments opened up. They are open. So if you're eligible, and for right now, that's everyone in Washington 16 and older, please make an appointment. We consistently have appointments available. Obviously, this is our way out of this, and we do need folks, of course, to continue wearing masks and not congregating, but vaccines are sort of the foundation of our way forward. So please don't miss your shot at getting your shot. And to talk more about how we're doing some of the community-based clinics and other things with our great partners from our fire EMS community, I'll turn it over to Shawneri. Shawneri Guzman's the Community Outreach Manager with South County Fire. So Shawneri, I'll turn it over to you.
Thank you, Jason. So I've been working with our mobile vaccination teams as part of the Snohomish County Vaccination Task Force. Our teams consist of fire EMS personnel who have been traveling all across Snohomish County to provide vaccinations for residents that would otherwise not have access to them. And that's due to physical limitations, perhaps mental limitations, transportation, and other issues. Our teams are through South County Fire and Everett Fire, and we work together to make sure that we're covering all of Snohomish County and not just our service areas. We started in January, and our primary focus then was with long-term care facilities and adult family homes. And we were able to get through all of those facilities with first and second doses. And then we moved on to our homebound individuals for in-home vaccinations. We used a variety of all three of the different manufacturers, Moderna, Pfizer, and Johnson & Johnson, depending on availability week to week. Those homebound individuals come to us through different ways. Primarily, they come through the health district, through that call center that was mentioned earlier, and they get placed on a list, and then that list gets pushed forward to the mobile clinics, and then we try to go out within that week. So it's a fairly quick turnaround time to provide that first dose vaccination. For these homebound individuals, they're at high risk for a couple of reasons. One, they have some medical issues that make them at higher risk, the comorbidities, but also they have family members and caregivers that are coming in to provide care for them every day. And those caregivers may be moving from home to home because they might be serving more than one resident at a time. So they do have that exposure risk, and we want to be able to make sure that they're protected as well. Our mobile teams personally have reached 61 facilities, but in partnership with the different pharmacies that are also going out to facilities, about 199 facilities have been served through the mobile units. For homebound residents, we have actually vaccinated nearly 200, 199 to be exact. We will make that 200 today. So that's 200 individuals in their homes that have been vaccinated. And that number actually is a lot more astounding if you think about the logistics of what it takes to do a homebound vaccination. It takes, time to come in and introduce ourselves to provide the vaccination, and then wait that 15 or maybe even 30-minute observation time that's required, and then travel to our next destination. And we have geography and we have traffic that impacts that time as well. So we have to be very good at planning out our day to make sure our drive time doesn't impact our ability to do as many vaccinations in a day as possible. In addition to homebound and long-term care and adult family homes, we're also participating in some small pop-up clinics for our BIPOC community. And so we've been doing those about once a week, and those have been very successful as well. Again, if people are looking for vaccination for their homebound loved one, they should go through the health district, and the health district will help either find a vaccination close to their home or place them on the homebound list, which will come to us. And again, about a week turnaround time is all. That's my presentation. Hopefully, if anybody has questions, they've popped it into the chat box.
Great. Well, thank you, Shawneri. And we'll go to the questions now. First one is, what are your thoughts on CDC's relaxed guidelines when it comes to mask wearing, and what do you see as potential impact on outdoor events, high school games in schools, recess, etc.? Doctor, probably aimed at you.
Well, the guidance from CDC allows folks who are vaccinated to, one, meet with other vaccinated people indoors without masks, to meet with people from a single other household who are low risk but not vaccinated. I have mixed emotions about that, but it's permitted. So there you have that. And then, their guidance also talks about, in a broad sense, if you're outdoors and not closely crowded and you're vaccinated, you're probably okay not wearing a mask. And, that's all based on science. So that's all fine. I think, rather than getting lost in the details of the guidance, it's, just the broad principles, which is, if you're unvaccinated, a face covering everywhere all the time, except when you're at home, is, the standard. If you're vaccinated, then certainly when you're at home, you don't need to wear one. When you're only with other people indoors, or who are also vaccinated, or when you're outdoors and things are spread out, that's very, very low risk. But indoor activities, crowding, what have you, even if you're vaccinated, we think it's a good idea to keep wearing the mask in those settings because, cases still do occur. These vaccines are outstanding and safe, but they're not perfect in terms of preventing all infections. So especially with the variants emerging that have some possible reduction in susceptibility, if you will, to the immune reaction that we get from vaccines, makes a lot of sense to just play it on the careful side because this virus has been sticking around for quite a while now. So I wouldn't say it has the upper hand, but if we back too much off our general prevention measures, I think we're going to regret it.
Yeah. Is there any concern that the new guidance will lead to causing an overall rise in cases?
Well, not if everybody gets vaccinated and everybody really sticks to the guidance. That means if you're not vaccinated, those liberties don't apply to you, that are mentioned. And I think it's important to remember that. One of the difficulties, of course, with this is a growing proportion of the population becomes vaccinated. That's a good thing. It's great. We're on our way. But if you're out and about in let's say a somewhat crowded area, like a shopping mall or an outdoor mall or, a park, and you see half the people not wearing masks, that can be unsettling. It can also kind of give you a false sense of, well, maybe I don't need to wear one either. So, I would stick to the broad principles, which is spread out is better than crowded. Being with vaccinated people is better than being with unvaccinated people in terms of safety. Outdoors is better than indoors. And as you gather more of those negative factors, even if you're vaccinated, it merits thinking about putting on that mask. And especially if you're unvaccinated, anything crowded, indoors, all that, unvaccinated people around, all those things, face covering. So I still think it's the default, and we shouldn't get too fancy about deciding when or when not to wear one. I personally wear one whenever I'm not at home and, totally distanced out from other people, even when I'm with other people in the workplace who are vaccinated, just to kind of keep the habit up. And let's, my personal thought is let's get a little further down the road before loosening up too much.
Okay. Next question, again for Dr. Spitters. Probably, are you seeing major outbreaks at restaurants, retail, sales, gyms, bowling alleys, etc.? And if not, is it fair to restrict them to 25% capacity? Should you go to phase 2?
Okay. Well, first, we are seeing workplace outbreaks and cases uptick, I think roughly doubling off of their base back in March when we bottomed out. So there is transmission occurring in indoor workplaces. And historically, when you look at where clusters and outbreaks of cases occur in workplaces, retail, construction, restaurants are the main ones. And when you look at both models and sort of retrospective analyses of what worked in earlier waves, it's face coverings and reducing exposure to public indoor environments. So, I'm not the arbiter of what we do as a result of the increase in case rates and hospitalizations. That's really in the governor's hands, but it's based on science. And Whether it's fair or not is not for me to judge, but it is a good public health measure.
Okay. The last time the majority of the state was on the verge of slipping, the governor changed how they evaluate the metrics. Have you heard anything from the state about changing the metrics again? I'll just lead off by, we have not heard of any discussion about that. Maybe the health district has, but the governor was in Snohomish County last week, was asked that question. He said there was no consideration at this time of changing the metrics. So I would be very surprised if there was a change in order. Dr. Spitters?
I've heard nothing to that effect.
Okay, it seems like young people are getting a lot sicker from COVID lately. Any idea if that's attributable to the rise in variants, and is the county seeing that in hospitalizations?
Well, I think first the overarching view would be we're probably in our, either in our personal lives or in wherever we're getting our information, we're probably hearing about more severe cases in younger folks because there's more cases in younger folks. So that's probably what's driving that is detecting the numerator, the number of severe cases, but that's really driven by the denominator, which is the total number of cases occurring in younger populations. And young adults ages 20 to 39 are definitely leading the pack in the rise in cases over the last month. Hospitalizations have shifted from being mostly older than 60 and 65 to younger groups. Still, most of the hospitalizations are in the 50 to 59 group. But what we're actually seeing less severity overall in that if you look at hospitalizations, the per person need for mechanical ventilation is much lower than it was in previous waves. But people are still being hospitalized, but I'm seeing less use of mechanical ventilation, suggesting that even though there are younger adults landing in the hospital with COVID, it hasn't been quite as severe. But we do have to keep our guard up about these variants. Now, so far, the only variant that we've seen that has a higher hospitalization rate than all the other cases is the P1 variant, with about 9% of those cases being hospitalized in Washington state, as opposed to 6% of all other cases. Otherwise, the variant, if you look at them variant by variant, they're either equal to or less than in terms of hospitalizations. At this time, the P1 variant is a growing but minority of cases in Washington state. It's still driven by the B117 and the B1429 and 427 that are more transmissible, are leading to more transmission, and as a result of that, more hospitalizations. But the per case hospitalization rate is not higher than it's been otherwise. Executive Summers, you're muted.
Man, thank you. Is there any data being collected to determine if the mRNA vaccines are having therapeutic effect for long COVID?
I've heard nothing to that effect. Seen nothing in the published literature, and I'm not aware of any trials looking at that.
Okay. And any update on the clinical trials for vaccinating youth 12 to 15? Is there a timeline? Is there any attention being given to that demographic?
Well, Pfizer reported that several weeks ago now, reported in a news release that the results of their phase 3 clinical trial in adolescents, I think ages 12 and up, had excellent effectiveness and safety, equal to or better than what was seen in adults, and expressed their intention to expand the emergency use authorization for their vaccine down to 12 years of age. But I've heard nothing further about where that's going. If you look on the FDA website, I don't see a meeting about that. I know that it's an abbreviated process because it's an expansion of an existing EUA as opposed to establishing a new EUA, but the timeline and the details on that, I don't know. The general process will be that at some point, presumably in the near future, the FDA would say, okay, presumably their panel would meet, and they based on what I'm hearing in the data that they've reported, but hasn't been peer reviewed or published yet. But let's say it's a favorable response from the FDA. They would say, okay, you can expand the use down to 12-year-olds. And then again, CDC's Advisory Committee on Immunization Practices would then look at that and provide formal recommendations for clinical use that reflect that data. And then we would expand the use. But given that there's been no activity in that lane, I'd say it's at least a few weeks off, because once that first domino falls with the FDA, it takes a few weeks for CDC to get through it, and then for things to kind of come our way. But the Moderna has a phase 3 trial ongoing, and they have not reported anything on that yet.
Okay. Do you think tying a county's vaccination rates to the reopening metrics would incentivize folks to get vaccinated quickly? And Dr., this touches on something we've discussed just briefly about since vaccinated folks are less susceptible, there's some merit to looking at different metrics for businesses, for example, that require vaccinations.
Well, you know, there's certainly been discussion of that, and I think I don't have a clear answer for you. I think there's two ways of looking at it. One is, look, if the vaccines are rolling out and the vaccine's working, cases are going to go down, hospitalizations are going to go down. So counting vaccinations is just counting twice. So let's just stick with the metrics we've been going with, because that's the result. The cases and the hospitalizations are the result. The vaccine is the method by which we achieve that result. Let's just keep measuring the result. That's one line of thinking on this. The other is, as your question suggests, you know, using that metric, you know, essentially as a promotion tool to get communities and people within communities to place a higher value on vaccine maybe than they already have, and to reduce some hesitancy or help some people who are on the fence feel more motivated to get vaccinated. I think those are, that's the paradigm. I haven't seen a choice made at the state level about that. I know it's been discussed.
Okay. And how much of the Johnson & Johnson vaccine is available in Snohomish County at the moment, and where will it or is it being distributed?
Well, right now we have zero new allocation. I think there's in our freezers somewhere, one of the various deposits of vaccine that we have. I think there's just something like 1,500 or 2,000-ish doses left. Those are likely to make their way out through the community clinics or outreach efforts that Director Biermann and Shawneri discussed, and or mass vaccination clinics right now. Looking forward for the next few weeks, the state anticipates allocating only 4,000 doses statewide. So our 10% allocation of that would just be 400 doses. So until the supply and distribution at the national level picks up steam for Johnson & Johnson, it's going to be kind of a trickle once we've used up our inventory that's pretty limited right now.
Jason, did you have anything to add to that?
Yeah, just a couple. There's Dr. Spitter's right. There's about 2,600 doses. The plan is for about a quarter of that to go out through the community-based efforts. The remainder to be split between Ashway and Boom City. We are letting folks know when they sign up. If they sign up for either Boom City or Ashway, they know that they're signing up for Johnson & Johnson. When we establish the clinics, we let them know that the vaccine will be Johnson & Johnson, and so far we haven't had anyone who has opted out. So we haven't seen a lot of hesitancy with folks who have been asking or scheduling with Johnson & Johnson. So I just wanted to add that's a good news. good news story that we haven't had hesitancy with use of that.
Okay. Were there any predictions early in the pandemic on how quickly COVID-19 would throw out variants? And did it happen more quickly than those predictions? If it was changing more quickly, what reasons are causing that pace? Doctor, any information on that?
No, we knew that from the get-go that coronaviruses do mutate at a slower pace, for instance, than influenza usually, but it was never really applied to models to predict the course of the pandemic, and yet our experience doesn't differ from any predictions, because I don't recall seeing any predictions along those lines, and I think what we're witnessing is expected. And will continue to occur, and just speaks all the more to, where do those variants arise from? The pool of existing infections. Less infections, less future variants. So it really speaks to both through vaccination and through our prevention efforts to reducing the pool of infections from which those could arise.
So our last question, I'll give each of us opportunity to answer it, but how difficult is it for you to see these cases and hospitalizations continue to go up despite the messaging to follow restrictions to limit the spread? And I'll just start saying it is frustrating. However, we are not the only ones experiencing this. We see it at the state level, we see it in various places around the country, and we see it in various places around the world. So, to me, it's painful because I know businesses and families are hurting. The restrictions are frustrating, but it just makes me all the more resolute in pushing folks to do the right thing, wear your masks, socially distance, get vaccinated. At this point, that's our path forward. Get vaccinated. I've been fully vaccinated now, and I just encourage everybody to do it. The vaccine has been shown to be safe and effective, very effective, and that's our really path forward. So, Doctor.
Well, yeah, I mean, it's painful to watch the impact on the community, both in terms of illness and hospitalization. We do still have deaths occurring, and then the economy suffering. The way our kids are getting educated has had to change, and certainly less fun for them and everyone, and a lot of suffering going on out there, both medically and socially and economically. So the sooner we can get this wrapped up. I mean, in one sense, we'll never eliminate coronavirus transmission, but we can definitely get it way down by rolling out the vaccine effort and then, getting there. So, it's hard to watch this, but it's happening. And so I, again, just encourage everyone, it's like if we're in a lifeboat, when we see land, it's too soon to jump in the water and swim to shore. And I think that there's a little bit of that going on. Plus we have the variants that accelerate transmission. So I think staying in the lifeboat, that's the prevention measures, getting vaccinated, and wait until we're a little bit closer to shore to open things up the way we've been seeing some folks do in their personal lives would be great for themselves and for the community.
Jason?
Yeah, I think you and Dr. Spitters have covered a lot. It's difficult. It's painful that, our team works really hard to make vaccines available and accessible, and we want folks to take advantage of that. But to your point, Executive Summers, I think it also makes us more resolute in those efforts, and making sure that we are getting out and doing everything we can so that vaccine is closer to folks. I think we see it a little more as well because of the other programs like Nourishing Neighborhoods and other things where we're seeing more and more folks impacted by this. So again, as everyone has said, encourage each other. If you're already vaccinated, that's awesome. Encourage your friends and neighbors who aren't to go get vaccinated. That's our way out.
Shawneri, last word.
Yeah, so for me, I'm, concentrating on just moving forward and doing my part of what I can do. But what I will say is we hear almost on a daily basis from individuals, thank you for the vaccination, because I really just want to hug my grandkids. And so that is what kind of keeps us going despite the frustration with, hospitalizations and case counts continuing to rise.
Great. Well, thank you all.
This is Heather in the Joint Information Center. Thank you again for joining us today and for your questions. We're going to wrap up for today, but please